I want to tell you something. Our brains, if we don't have teeth,
We would like to know what is your fear when you are doing implant.
if you lose one tooth, the adjacent teeth will move.
All right, doctor, let's break it out. What are the options to replace a missing teeth nowadays?
Nowadays in modern dentistry,
Let's say I have a missing teeth. So how can I decide or how would I know what is the right treatment for me?
well, let's talk about implants.
Hi, Apa Khabar. Welcome back to Queen Podcast. Let's talk. I'm your host today, Shirley, and it's great to have Dr. Yazan, who is implant specialist, with us today, who is the one who restores the confidence and also the smile of the patient. Welcome to the show, doctor.
Hello, Cheryl.
Hi,
Hello,
doctor.
Shirley.
Yeah.
Yes, sorry.
Shirley.
Shirley, yes.
Yes, doctor.
Yes. Hello, Shirley.
Hi.
Hi, how are you, dear?
Good, good. How are
Yes.
you today, doc?
I'm fine.
Yeah.
Yes,
Good
doing
to hear
well,
that. Yes, doctor. Actually, I just want to know that, like, how many years of experience you have in dentistry?
Actually, I have 18 years of experience.
18 years?
Yes.
Oh, wow. What is your age, doctor?
It is 29.5.
Oh, okay. I'm still younger than you. All right, doctor. Today's topic actually affecting so many people, missing teeth, whether it's because of decay, trauma, or because of the age. Why is so important that we have to replace the missing teeth in your thought? What is your thought, doctor?
Actually, it's a classic question. During our lives, sometimes we have some accidents and sometimes we forget about our teeth and it happens to lose one or two teeth, and some people actually they lose many teeth. Some genetics to periodontal disease and some of them negligence because they were busy having not the best lifestyle or getting busy for their families, for their personal growth. So restoring a missing tooth is important because it's like a dominoes effect. If you lose one tooth, the adjacent teeth will move towards that missing space. And so the upper tooth, let's say we have a missing lower molar. So the upper molar will go down, the adjacent teeth, second molar and premolar will really shift towards this space. This is how the bone remodels around these missing spaces. And eventually you will also lose the bone that inside of your jaw, and it will be difficult to restore the space in the future.
Yeah, so this is how we get to know some of the patient. After some time, they come to the clinic and they want to restore the missing tooth, but unfortunately there is no any option because I guess it's what you say, doctor, the tooth is already moved, right?
Yes, and if you leave it for a very long time, we will end up actually of maybe removing the other tooth or doing extensive orthodontic treatments, which are still an option for it. Of course, the first option is to save teeth. Yeah, I want to tell you something. Our brains, if we don't have teeth, the brain does not want to invest in these areas. So the bone will dramatically be reduced and the brain will try to actually support the other teeth. So even if you take x-rays for it, if you have a long time missing tooth, you will find out that we need to do something called bone augmentations, even sometimes soft tissue augmentation. We add some gum or some bone powder just to fill up this space.
Oh, there's a lot of side effect if we are just
Yes.
ignoring it. All right, doctor, let's break it out. What are the options to replace a missing teeth nowadays?
There are a couple of options. If you are a spontaneous person, you want to have you have some emotions and you want to, like, let's say you want to get upset comfortably, you want to be sad comfortably. I don't think the first option, dentures, suits you well because dentures are slipping. Sometimes if you want to raise your voice or you become too much drama, and maybe you will become also too much sad because some of these dentures, if you do not put adhesives, because they require adhesives, so they will slip, but they are affordable choice. They are easy to make, affordable, and you can consider it provisional. Yani some people, they have some priorities in their lives. Right now, they can just have the dentures. Maybe the second option suitable for many people, which is the fixed bridges. Fixed bridges it's a valid treatment plan. You do not feel that there's something big in your mouth or artificial like the dentures. So you feel that is natural and you feel that is comfortable, but sometimes there is a cost for it. You have to reduce the other teeth, the abutments, and it has also some limitations. Some of the preparation needs to go for root canal for these teeth, which is more invasive than doing, let's say, the implants, the third options. Implants, you just leave the teeth as they are, no need to touch them, they are still durable. You just place one implant between two teeth and that's it. And nowadays in modern dentistry, we have many technologies like cone beam CT scans, 3D X-rays, we have computers. Sometimes we can even do it with minimal surgery. No need to do suturing or anything, just a small punch in the tissue and place the implants and load it right away.
So as you mentioned, doctor, there are three options that to replace a missing tooth. So let's say I have a missing teeth. So how can I decide, or how would I know what is the right treatment for me? So because there are three options there.
First of all, the age. So if you are underage, like below 18, we will not propose to do crowns, bridges or implants. Of course, something removable or something provisional that will be cemented or glued to the other teeth, because the bone remodeling is not yet stable, the eruption of teeth is not yet stable. But after 18 years of age, you can have all the three options. It really it depends on the budget, it depends on the time that you will spend. Some people, they come here for, I remember 2 days ago, there was a patient that asked to come to Queens here for full mouth implants. You cannot do it with bridges and dentures like this, but with implants, you can do it same appointment. Implants actually is my specialty, and it's really a painless procedure. You will get covered also with antibiotics, with painkillers. So when we do these procedures, usually it's easier than root canal, easier than tooth extractions. And this is what you expect when you do the implants. Just a minor trauma and that's it for the procedure, for the local anesthesia, nothing more than that. You can do it, you can travel after 2 days.
Yeah, so actually I believe most of the people is interested to know if the implant, is it painful or is it suitable only for the older people?
Older people are sometimes maybe more indicated than younger people, because old people, they usually have many missing teeth and they don't like to come and have these repeated sessions. And we have many solutions for their age, like if they have some bone atrophy, we can add some bone powder to it. And if they have some other alterations, we can do it at the same appointment. So the pain is really manageable, and you should ask your friends, your family, your relatives. Nowadays, it's very common. In every family, in every cousins, maybe they have implants. And they can tell you about their stories.
Thank you so much, Dr. Yazan, to sharing with us his knowledge and making this topic is so approachable. So before we end, Doctor, as you know that last episode, Dr. Amil showed us that his own talent, which is he's a good dancer. So what about you? What you want to bring to us this episode, Doctor?
I brought my 32.
Can you show us your veneers?
I brought
32
actually my
pieces.
32 veneers. They are phosphatic veneers. I cannot bring my microscope. It's upstairs, very big.
Oh, as we know, Doctor, you are not only doing the implant, right?
Yes.
Yeah, so you do also veneers and with microscope for your root canal as well, I believe, yeah?
But also implants can be placed under microscope. Sometimes people, they are curious about it. Some people like cats, they want to really curious about everything. So I can shoot a video under microscope. It adds also to the quality of the procedure. And they can take the video with them. We give them small USB for it.
Oh, means that when you are doing the procedure, you are recording with the microscope?
Yes.
Oh,
so
that's
spread the
interesting.
news also to their families and their colleagues.
Oh, that's good to know. Okay. For our audience, if you or your friend have missing teeth, what you are waiting for? There is a solution. Don't worry about that. We are here for you. Visit Queen's Medical Center.
Thank you guys for listening to us, and see you on the next episode.
Until next time, keep smiling.
Bye.
Bye. Hi, Dr. Yazan. Actually, we would like to know what is your fear when you are doing implant?
The way I feel, actually I came prepared, so...
Oh wow, prepare!
Like this.
Ta-da!
Yes, I'll be back. You know who said I'll be back?